Ganz herzlich heute Professor Dr. Gunga begrüßen zu dürfen von der Charité, Nick Watts vom Lancet Countdown on Climate Change and Health und Professor Dr. Claudia Traidl-Hoffmann von der TU München und dem Helmholtz-Institut. Und der Teil von Nick wird tatsächlich auf Englisch stattfinden und wir werden es diesmal so machen, dass die Fragen auch auf Englisch direkt nach seinem Vortrag kommen und dann schließen sich die zwei deutschen Vorträge an und dann findet nochmal im Anschluss an beide eine größere Fragenrunde statt, aber da wird Nick nicht mehr dabei sein. Okay, so that was a lot in German. Nick, sorry for that. But we're very glad to have you here in our Planetary Health Academy because you're also a very important part for us. For example, I mean, we know each other for a longer time because you're working on the topic of climate change and health for already many years. You're a doctor as well, and last year you've been working together with us for the Lancet Countdown policy brief for Germany. So you're always open for big ideas, and I mean, I could say you always make the things that seem impossible possible. So you're a really big driver as well for our movement. And we would like to start with a personal question. What motivates you and what keeps you up doing all this stuff all the time?
Thank you, Sylvia, as well. I presume all of that German was you just was you talking about how funny I was, how sort of generally athletic Australians are, how intelligent we are, how humble we are. Is that right?
That's right, exactly. But also all the content stuff. I mean.
Oh right, of course, all of that as well. Yes, yeah. Sorry. To answer your question, and I'm sorry to everyone, I speak almost no German, so I won't even try. It's a curse that comes from being based down at the bottom of the world in Australia, or London now. Why do I work on this? Why would you work on anything else? There is no greater challenge facing humanity for the century. There are small short-term things that are coming along, and there are short-term crises, but this is a century-long challenge that integrates with every single part of what medicine, public health has to offer, has to deal with. You get to work on extreme weather events. You get to work on health system adaptation, poverty reduction, migration, and the health effects of that. You get to look at energy systems, transport systems, food systems. You get to engage in sort of the hardest and most interesting of science and advanced modeling, and you also get to engage in communications and advocacy and policy. That's why I don't understand why everyone else isn't. And as to what keeps me up and what keeps me going, it's you guys. It's the people that I get to work with. That's where I draw all of my hope and all of my inspiration from, is that when I started in 2007, there were 6 or 7 of us, and we sat around a table at COP in Bali, and we were the entirety of the contingent on health and climate change, showing up to talk about that stuff. And we were a very, very small group. And the world has completely changed. It is insane how many people you have here. I genuinely am not sure I quite believe it, but it is the sign of things sort of going from linear to exponential.
I can only add on this, like, to all the listeners, you're really insane, and you're not insane, like, but amazing as well, because last time we were like 1,700 on this webinar, and we're still really amazed and we're really thrilled to keep this going. So Nick, you're the director of the Lancet Countdown on Climate Change. Maybe you can give us a few words on what the Lancet Countdown is, and then the stage is yours for your presentation as well.
We produce reports. Really, really simple. That's all we do. We're a collaboration of way too many academic institutions, UN agencies. We are scattered across every single continent. We bring together 36 at last count institutions and 85 experts, doctors, engineers, economists, climatologists, philosophers, lawyers. The doctors are actually the most annoying. They are the hardest to argue with. We do a simple thing. We track the pulse of the planet. We track the pulse of the planet, and once a year we come back, we put it in a report, and we give 41 indicators of how health and climate change are linked in the year that's just passed. It's an exciting day for us to be talking about this, because today I have finally finished all of the analysis for our 2020 report, and am tearing my hair out trying to write the executive summary for that right now. So I'm excited to take a break and come and talk here.
Great. So
should we go?
We can go, yeah.
Let's do it. Okay. Tell me, people can see things?
Now they see your presentation.
Now they see my presentation. Fantastic. Okay. So, hi everyone. I've already said it. It should be obvious because you can hear my accent, but I am Australian. I am very Australian. I'm so sorry. There's almost nothing I can do about my accent, and I'm so sorry that I don't speak any German. But I'm sure that Sylvia, Sabina, Martin, all of our lovely panelists would be glad to translate, but also just summarize in far more eloquent and intelligent ways what I'm going to talk about. It's really simple. We're going to talk for 15 minutes, 20 minutes. We're going to be as quick as we can so that we can prioritize some time for questions. We're going to talk about the links between public health and climate change. It turns out that when the environment changes, everything changes, because it turns out that the environment is everywhere. We just forgot because it stayed the same for a while. Everything we're going to talk about using the data, the analysis, the methods that we draw on for the Lancet Countdown. We draw on data and research from all the way across the world. Some of it is our own, but large parts of it, we're standing on the shoulders of decades of work here. This work has been going on for a very, very long time, and we draw on the best available science there to try and present it out to the world. In response to what we think is the biggest global health threat of the 21st century, what we think is a threat that has the potential to undermine the last 50 years of gains, we did what any sensible public health professional would do. We got too many academics and we put them in a basement, because that's where they do their best work, and that's where academics do their best arguing. We started with University College London, but we very, very quickly realized, hey, this is a global problem and it needs global expertise. And so we expanded out, and we have partners scattered across the entire world now. We even have Australians. The University of Sydney is there somewhere, I think. In response to any sort of global health crisis, you have to put all of your academics in a basement, but then you also have to tell them to do, the simple thing. They have to go and write reports. And so we produced our simple report. This is the 2019 report. The 2020 report is coming out sometime in October. It's still a little bit away. And that's interesting. And I'm being slightly flippant because we do spend most of our time at the Countdown working on making sure that we're producing so much more than just a report. The big failing, I think the biggest failing of all of science and all of medicine is the assumption that if we just get the right facts and we put them out into the world will care and the world will listen. It just doesn't. It just won't. And one of the core things that the Lancet Countdown does is we take that into our own hands. We make sure that we get the policy engagement right. We make sure that we get the communications right. And we do that ourselves because we know that if we just put another report out, they would just be a stack of 5 reports. No one would care. So we get all of our academics, we put them in a basement. We ask them to write reports for us, and they do that. And in those reports, we produce graphs. We actually produce quite a lot of graphs. It turns out the world is a big place, and it turns out there's an enormous amount of data out there. I flashed this up. Everything that we're going to talk about is freely available online. We have a data visualization platform. You can go and you can check out what is happening in your country in Germany. I presume the Germans don't like the New Zealanders, like Australia. So you can compare what Germany and New Zealand are doing relative to one another. You can compare regions and you can compare across indicators. Everything that we have here will move quickly, but it is all freely available, even if it doesn't always make an enormous amount of sense. When you take a look at all of the indicators that are stacked up across the Lancet Countdown, 41 indicators. We track anything from exposures to extremes of heat, heat-related mortality, through to the climate suitability for the transmission of dengue fever, of chikungunya, of Zika, of malaria, of Vibrio and Vibrio cholera species, through to coal-fired power plants and air pollution that comes from that, and then the air pollution that causes the mortality. So we track deaths from there, and then we go the whole way through and look at the health system costs as well. When you look at the entirety of those as a whole, two things stand out to me. The first is that the human symptoms of climate change, they are unequivocal, they are irreversible, and they're affecting people around the world today. In fact, the life of every child we think born today is going to be profoundly affected by climate change. Unless we act pretty quickly, we're entering a new era where climate change is going to come to define the health of people at every single stage in their lives. And when we think about how you sort of arrive at that kind of conclusion, I mean, you know, there are lots of different life cycle assessments you can get at, but a really simple way of thinking about this is a child born today, average life expectancy, if you're a bad epidemiologist, average life expectancy is about 71 years old, 71 years. 71 years from now, we're going to hit 4 degrees. That child born today is going to experience a 4-degree world. Now, climatologists will tell us that they have a rough idea of what that looks like, although they get pretty uncertain. An epidemiologist will tell you they have absolutely no idea what that looks like. What we do know for sure is that health systems, the NHS, the Australian, the German, and health systems all the way across the world in high, middle, and low-income countries, they were not built for a 4-degree world. They were not built with the understanding that everything would shift. And so that child born today is going to have to contend, both today and growing up, with worse food security. Here we show shifts in global yield potential reductions of somewhere between 2 to 4%, depending on whether or not you're looking at maize, winter wheat, soybean, rice. We also track spring wheat, but five graphs doesn't look quite as nice as 4 graphs does. So you see reductions the whole way through. Now, this is just global yield potential. It's global yield potential driven partly by climatic shift and partly by climatic shock. We are starting to see actual yields drop as well. And with actual yields dropping low, particularly in some of the most vulnerable parts of the world, and you look primarily at Southeast Asia, primarily at sub-Saharan Africa, there are 37 countries in the world that we are really worried about here. And we're worried about them because they have limited food security as it is, with an already undernourished population. They don't have access to deep regional food markets and deep global markets, and they are in particularly climate vulnerable parts of the world. Kids under the age of 5, when they're hit by this sort of stuff, those life-changing sort of health effects of malnutrition, what it does to your head, to your heart, to your stomach, they last the whole way through. They don't just sort of recover after a brief period of hunger. And when we look at work from the London School of Hygiene and Tropical Medicine, we expect this to be pretty bad. We expect an additional 9 million children stunted as a result of the food shocks from climate change by 2050 in sub-Saharan Africa, 7 million in Southeast Asia. So that kid grows up a little bit, and then they start to contend with shifting patterns of infectious disease. Here we show from 1950 up to present day, up to 2020, the shift in the climate suitability for the transmission of dengue fever. We see somewhere between a 7 to a 10% roughly increase in the climate suitability, depending on whether or not you're looking at Aedes aegypti or Aedes albopictus. We take a climatologically stable 1950s baseline and spread it over a couple of years. That's a really concerning shift, but what's also concerning is that if you then go and narrow down and you say, okay, well, how about that same question, but for Plasmodium falciparum, one of the worst causes of malaria, one of the worst forms of malaria, and we look just at the highlands of Africa, of sub-Saharan Africa, there we see a 20.9% increase. Or we look at Vibrio infections, the wound and the diarrheal disease that you see, and we look at the Baltic in Europe, there we see a 24% increase, or northeast coast of the United States, a 27% increase. Now, sometimes you see spikes there, but sometimes you see that public health interventions have managed to counteract what would otherwise be a really quite worrying trend. The point I think we're trying to make here is that the climate is shifting in a way that is undermining a lot of what public health systems are traditionally able to respond to. And we are starting to see some of those health impacts shine through. So that kid grows up a little bit more, and maybe they want to start a family. Maybe they want to start to own some assets. Depends on the kind of world you live in and the part of the world you live in. If we take a look at extreme weather events, we are seeing a spike. We're seeing rises in the occurrence and in the number of people affected across a whole range of different extreme events, flood, drought, heat wave particularly. But here we track wildfires. 152 out of 196 countries saw an increase in the populations exposed to wildfires from their early 2000s. Here we start in the 2000s because, to be honest, the satellite data gets pretty dodgy as you go further back. And so this is, I think, the best that we're able to do with the evidence we have here. But it tracks really closely with what we would expect to see given climate change. Now, for wildfire, that's important because there is obviously direct thermal injury, and that's bad for health, but there is also the air pollution effects. And we see this across Australia and across Canada and across the west coast of the United States, where all three of those parts of the world were on fire last year. Every single state in Australia declared an emergency because at one point and over the course of 3 to 6 months, the entire country was on fire. That's bad for short-term health, but there are also long-term effects there as well. There are mental health effects that come from this, and they don't show up in the first 3 days. They show up in the next 3 months, 6 months, 9 months. Those spikes that you see in affective disorders and anxiety-related disorders, in thought disorders, schizophrenia as well. And then the household effects. We know that wildfires don't result in quite as much damage to human health per event as an equivalent sort of that you might see in flood. But what we do know is they have an enormous economic impact on individuals, 48 times higher on individual households in terms of the economic effect per event. That's an important consideration when we start to think about the broader determinants of health that we're walking into. That person, once they've thought about their family, they've thought about the assets they might want to own, they're going to get into old age at some point if they're doing it right. We know that people aged 65 years and over are particularly vulnerable to extremes of heat. And this is a problem that Europe is facing first and is facing hardest. And it's one of the sort of biggest concerns that they're dealing with. In 2018 alone, we saw an additional 220 million vulnerable people exposed to extremes of heat. That's an enormous increase in exposure events around the world. By vulnerable people, we take that, we do a fairly simple definition: people aged over 65, people with pre-existing chronic illness, and people, the urban poor, people that are unable to access sort of adaptation measures that they may otherwise need to sort of get out of it. Now, those are some of the direct impacts, and in 2020, we're going to actually take this 1 or 2 steps further and present not just exposure, but go the whole way to mortality. What we also capture is the change in work hours. Sometimes it gets too hot. Sometimes in Australia, sometimes in India, Pakistan, China, it gets so hot that you just can't go outside and engage in physical activity. Now, that's not a huge issue in the United Kingdom where I am for outdoor workers. But for vulnerable populations that are outdoor workers, for people with disabilities, for migrant populations, enormous problem where you are suddenly facing a choice between either going out working and suffering the health consequences of that, whether it is exacerbations of congestive heart failure or worsening chronic kidney disease, worsening acute kidney injury, or foregoing your income and the health consequences that come from that just a little bit later down the road. So we see as that child grows up, the whole way through, their life is affected by different parts of climate change, because again, it turns out that the climate is everywhere, and it turns out that no country, no individual is immune from that. All of that is worrying. But it's not, I think, the thing that keeps us up at night. The thing that keeps us up at night is unhelpful diagrams like this that you kind of have to look at for a very long time before they make any sense at all. I don't find this diagram that useful for really much, except for one thing. It's a nice way that I use to remind myself that I'm not worried just about malnutrition, and I'm not worried just about dengue fever, and I'm not worried just about heat wave or wildfires or mental health or air pollution. What I'm worried about is the multi-hit scenario. You're worried about what happens when populations get hit again and again and again by risks that were previously uncorrelated, that become correlated because they have a common driver. And what happens when you start to wear away at the ability of a health system to act as an anchor institution to provide that community level resilience. When that flood comes back again and again, and it results in spreads as epidemics of waterborne disease, when it results in decreased crop yields and malnutrition, when it results in mental health impacts and it wears away at the health system, the hospitals, the health profession's ability to respond, that's problematic. But when it comes back 3 years later And instead, instead of the first time, as it did in Pakistan, cover 1/5 of the country's landmass, now you have a flood that covers 1/4 of the country's landmass. That's when we get really concerned. It's not those individual risks, it's that multi-hit scenario. And the doctors here and the health professionals here will know that that's what we get worried about, right? We don't worry about, we know that one kidney does okay. We know that the liver, if it takes an insult, can broadly recover. It's when multiple organ systems start to sort of be wiped out because you have multiple correlated risks. That's where things get really worrying. So that's that first path, eh? The life of every child born today will be profoundly affected by climate change. No country, no individual is immune. And we're not talking about 2100, we're talking about 2020. We're talking about the effects of everyone, we're talking about the health of everyone now. It's going to get a hell of a lot worse if we don't respond. But it is also, there are also effects we're experiencing right now. That's that first path. I've only got a couple minutes left, so I will summarize here, but there's a second path. It doesn't have to be that way. When you sit down and you ask all of the climatologists we work with, the hydrologists, the engineers, the food experts, the transport experts, the energy experts, when you ask the political scientists, the development experts, when you ask all of the economists and you say, well, what's going on? Why aren't we responding? Is it that there isn't enough technology? Is solar power not good enough? They will laugh and say, no, solar technology has been ready for a very long time. So has wind technology. We have the technology available today to respond to climate change. And you go, okay, well, is it that it costs too much? And you go and ask the economists, and the economists laugh and they say, no, that's not the issue. It turns out actually this isn't going to cost that much money, because all of the money that we're going to spend on this, it's going to lead to these sort of positive health benefits, because we're talking about phasing out coal-fired power, which will result in somewhere around 1 to 1.2 million less deaths every single year, and enormous economic savings for large countries, particularly China and India around the world, that comes from that. We're talking about encouraging physical activity by building safer cities for people. And there again, more physical activity, a healthier, more productive workforce. It's not the technology and it's not the economics. It turns out almost everything you want to do to respond to climate change, it has these enormous health benefits for public health. And that second pathway where we do start to respond, we're starting to see bits and pieces of it. In Canada, a child born today will grow up not knowing what a coal-fired power plant looks like. And the same is true for a couple of other countries around the world. There are 48 countries, I think, as my last count, although I'm sure the numbers changed since I last checked, that are phasing out coal just because it's a bad idea for public health, it's a bad idea for climate change. If that child's born in France, they won't be able to buy a diesel car. That country will have phased out diesel and petrol cars by the time they get to that age. And if they do it right, they won't even want to buy a car at all, because they will have designed cities and designed ways of living and working that are built around individuals and people's health. If they're growing up in the United Kingdom, that child will grow up experiencing a health service that has declared it's going to reach net zero well before the government's commitments of 2050, somewhere in the 2030s, we think. That's an enormous shift that child born today, the whole way through, is going to start to experience. And this is just another one of my very unhelpful diagrams that I think sort of summarizes a similar issue. It's probably, to me, if the first one is a reminder of the multi-hit scenario, this one is a reminder that you shouldn't try to draw diagrams you don't really want to know the answer to. But this is a diagram looking at all of the ways in which the response to climate change line up with the benefits that you expect to see for public health. It turns out that almost everything you want to do, if you do it right, they are cost-effective, sensible public health interventions in their own right. They're just good ideas. So there are two paths. Either way, climate change or the response to climate change is going to define the health of every child born today. It's going to define the health profile of their entire lives over the next 71 years, if you take their average life expectancy. Whether or not they take the first path of sort of impacts and all of the different sort of really quite concerning effects we're talking about in the first half, or whether we take that second path with these enormous benefits for public health. It's not a technological issue, it's not an economic issue, it's not a financial question. The technology's ready, the economics doesn't cost quite so much as we might be led to believe. And in fact, when you take a broader picture, The economics are on our side. It's now entirely a political question. And that's why the health profession is so important. That's why doctors, nurses, allied health professionals, public health professionals, everyday people from outside of the health profession that are just interested are so important. Because we've seen that when the health profession moves, it can move mountains. We've seen on tobacco, we've seen in HIV, we've seen in vaccinations. And that's why everything that's happening in Germany at the moment, I think, is so essential. It's why the work that everyone that's running this academy has been doing is so exciting. Because back in 2007, when I started working, I was late to the game, but back when I started working on this, there were just a couple of us sitting around a table. Now there are 1,400, 1,700 people sitting in talking about health and climate change on a Wednesday afternoon. That's a scale that I don't think we ever thought we would get to, and it's really, really exciting. So that's all I've got. Thank you very, very much.
So thank you, Nick. Thank you very much. Martin.
When we started to work together 1 year ago, it was still the case that German's health sector hadn't awakened, and this is changing now. Now, from the two paths you have described, the first one on the dangers and second one of the opportunity, where do you see the more ignorance? Are we more ignorant towards the opportunity or more ignorant towards the danger?
Oh, it's such a good question. I think the opportunity. I think we don't spend enough time thinking about the solutions. I think we spend too much of our time scaring ourselves. We spend too much of our time worried about the effects of climate change, and we should be. They're scary. But I think probably there was a period of time 5 years ago, 10 years ago, where the answer was both. We aren't talking about anything. I think we're starting to break through on the impacts, but I think as a community, we need to do a better job of talking about the solutions and talking about the world that we want to go and live in together and the positives to the side of that.
Yeah, I very much agree. I have a second question to you. You were talking about that you're most afraid of the multi-hit scenarios and what it does also to the health systems, that it breaks down the health systems, and then, you know, they can deal with one crisis, perhaps two, but then they break down. And I remember when you were talking about it 1 year ago, I had an idea, but I really didn't get it. But now with the Corona crisis, we are seeing in many, many countries how the health systems are badly breaking down, far beyond anything we could have imagined. Who would have imagined to see the pictures we have seen from Italy or other places, let alone some of the weaknesses you see in the global south? So what do you see as an opportunity rising from kind of the experience we are going through? Because now a lot of us know what a multi-hit scenarios can look like and what the follow-on consequences are for very different fields like economy, like pedagogics, like you know, the way we look at travel and all kind of other questions.
Yeah. I mean, you are, in a roundabout way, Martin, you're asking about the links between the next 5 years and sort of the work we have to do on climate change and how that links in with the recovery of the global pandemic. Well, the simple answer is who knows? The world keeps changing. Every time I form an opinion, I have to change my opinion sort of 3 days later because the world keeps shifting.
Yeah.
What I think I would say is the world has changed enormously just in the last 2 to 3 months. Now, emissions have dropped in a way that is really quite remarkable. I think I saw 17% from a paper out late last night, and we're expecting up to 8% reduction across 2020. It's so important that we note that that is not a decarbonization of the economy.
Yeah.
That is a freezing of the economy. That is a bad thing. There are no health benefits that we're gaining from this. There are no positive things that we are sort of drawing out. However, there are positive things we can take away. The event has happened. We have to observe it. We have to look at it and say, well, we responded in this way and that was unhelpful. But we also responded in these 3 ways. And these 3 ways, actually, maybe there's something we can learn from it. There is something we can learn from what happens in sort of digital healthcare and how we go about sort of providing primary care online. And there are things that we can learn about place-based communities and place-based work that I think there's a lot that we can draw from there. I think we need to work really hard to make sure that we draw and go looking for those positive examples, because the world has changed in a profound way and we have to draw on that. But we also need to not be naive to the politics that we're walking into. The world has changed, and the world is about to become a bit of a harsher place. We know that when we're faced with some of these threats, we don't always come together in the most collegiate and collaborative and lovely of ways. Sometimes, in fact, we turn against each other. And so we have to be aware that the world is going to shift over the next 5 to 10 years. And I think we just need to be sure that we are able to operate within that new paradigm.
Yeah. So the uncertainty will not go away, but stay with us for a long time. Good. Louise, are there already any questions that you would like to pose to Nick from the audience?
Yes, there were again some questions. First, thank you for a nice talk. I think I say it for everyone. And so again, we tried to cluster the listeners' questions and figured out some central. And I would start by ask you to briefly define what exactly you mean by the land to be climate vulnerable, just for the understanding.
By the what, sorry?
To define a land.
Vulnerability to climate change.
The vulnerability.
Vulnerability, yeah.
How's that? It depends entirely. The concept of vulnerability, the concept of impacts and adaptation, they are locally determined. They are determined by the impacts that we're talking about. People may be vulnerable to the extremes of heat that are not vulnerable to flood. And it depends entirely on the kind of thing that we're talking about, and shifts from country to country. At the broadest level, a couple of things hold true. The social determinants of health are important, right? All of the protective factors that we might expect to see from health system strengthening, that we might expect to see from all of those broader determinants of health, they will also be protective in response to many of these challenges you face from climate change. Poverty reduction and inequality is important. Broadly, we see that climate change exacerbates inequality around the world, and that the people that are least responsible are often the worst affected. And then I think finally, health system strengthening, sort of access to healthcare, access to some of those safety nets, those social institutions that we sort of invest in around the world. Those are sort of three things. There are then also geographical vulnerabilities. There are all sorts of bits and pieces. I mean, Sabina, you might have a more intelligent, nuanced response to that, but
I don't have a more nuanced response. But I was just trying to send a link through this chat, because there's an organization called German Watch, and they do a climate risk index, and I just put the link there so people can look it up. But of course, like what you said is really important, because it's not just where are the events striking, but also how able are people to cope with them. Yeah.
And I see it's one thing we see now also in the Corona crisis, how the social determinants and the strengths of the health system and the weaknesses of the health system are brutally exposed. And that's exactly what you can expect when we have a multiple climate crisis. That's the areas where you already have a lot of inequality. The poorest part of the population will be hit the hardest, and so on and so forth. So,
well, one thing maybe I wanted to comment or ask Nick is this sort of incremental versus tipping change. Because like some of the stuff you showed was like, oh, the harvests go down by 5% or something, and you think like, well, it probably varies by that year by year. I'm not impressed that much, but we also know that there's a risk of like huge shifts in the monsoon or in whatever, and tipping points in the climate system, and then that would be a total game changer. There may be like harvest losses in several big agricultural regions at once, and then all the political fallout from this and migration. And I feel that sometimes maybe that's kind of more important even to emphasize than these smaller shifts that humans are more able to deal with. And in the Corona crisis, I think maybe now people have understood that there's an increase in Corona patients that the health system needs to deal with, but then if it goes over a certain threshold and we can't deal with it, then people suddenly die from other things, and we're in a totally different scene, and we have to kind of both like adapt and kind of increase our capacities of the health system, but at the same time we have to prevent the unmanageable, and the same thing applies for mitigation, adaptation, and climate change. So I wonder, you know, how much should we more emphasize these sort of non-linear problems happening, but it also scares people, I guess.
Scares me. It's such a good question, because it is those threshold effects and correlation effects that scare me the most. Those are the things that I am most concerned about. And yet I sometimes feel like they can be quite tricky to communicate, right? So the one something that sort of grabbed me the most was a piece that came out from the British and Chinese government about 5 years ago that talked exactly about what you're asking, which is, what is the chance that 3 of the world's major bread baskets in a 2015 climate get hit by a climate shock all in the same year and result in an enormous global food crisis? And the answer is 0.1%, right? Then they say, okay, well, what if we don't take a 2015 climate? What if we go forward 10 years, 20 years, 50 years, and we go to a 3-degree climate? Now what is the chance? And the answer becomes, well, every year the chance is about 22%. And suddenly you go, oh my, it's not that little sort of incremental thing. It's the risk of these multiple enormous shocks. Equally, I think you're right though, Sabina. Probably people are sensitized into thinking about a little bit more of that, because we have seen some of those threshold effects in sort of healthcare around COVID-19. I think we should probably do a little bit more talking about it. It's also an area we don't know an enormous amount about, right? Like some of those things, it gets a little bit tricky to predict, right? When you start to talk about, I don't know, the risk of North ice shelf collapse and, you know, not one meter of sea level rise, but 5 meters of sea level rise. We know that those tipping points are really dangerous and scary, but we don't have enough to properly sort of, talk about it.
Okay, we can take one more question. Louise, can you pose one more question for Nick, and we have to move on?
Yes, so the last question with 2 parts. So if you and your team have seen a change between the first report and the last one, and how it was welcomed in the scientific and political world, and also where would you say are currently the biggest research gaps in the field of climate change and health? I hope it isn't too long.
No, I'll be quick. Yes, we've seen a shift. When we got going, we were looking around trying to convince people to be friends with us. We didn't have that many friends that are scattered around, and we had to sort of, you know, really introduce people to some of these concepts. Now in 2020, when you look around, there are health alliances all around the world. There are alliances of doctors, of nurses. There are health professional associations that are starting to talk about climate change anyway. And what that does is it means that we have someone that we can give the evidence and the ammunition to. But it also means that they have gone and sensitized the media. They have gone and talked about this to health policymakers. There's an ecosystem there that can sort of work together. That, I think, is really exciting. We have also started to see, and this has been an interesting and I think a really positive shift, governments start to turn around and come to us. Turn around and say, okay, hey, we would like to take this seriously. Can you help us figure out exactly what our risks might look like, or what these indicators might look like? Can you help us figure out what a net zero health service might look like? And that's a sort of maturing of this sector, I think, moving from something that is just really finding its feet into something that is sort of coming into the mainstream. In terms of the research gaps, they're everywhere. The research gaps are everywhere. This is an emerging field that touches on everything. What we do know, and this is from some of the data we just finished looking at, is that the vast majority, 65% of research on health and climate change happens in Western Europe and North America. We know that nowhere near enough, and that obviously reflects all sorts of inequalities in the world in general, but it actually outpaces the inequalities in the world. Nowhere near enough work is being done in low and middle income countries, the countries that are the most affected by climate change, and that has to shift.
Nick, thank you very much for your contribution. Thank you very much for being a partner. We see you again on the 17th of June, focusing on the subject of communication, how we can kind of get more people excited and get more people on board for the work we have in front of us. Thank you very much for your presentation. And now I move on over to German.
You have the next one, and normally we would be now meeting at the German Conference of Doctors, and you would be talking exactly about the subject you're going to make today. There, it's the health effects of climate change and the effects also on our latitudes, especially Germany, Austria, Switzerland, and the neighboring countries. We've known each other for 1 year now, and ever since we've been cooperating, I find everyone I talk to you, I feel that your commitment, your enthusiasm for this task has grown, and you always take the time to talk to us, talk to me when there is something at issue. Maybe you can tell us something about why this is and how this grew, and then we'd be pleased to see you talking about the health effects for our regions. Thank you very much, Martin. I'm surprised that we only have known each other for 1 year. It seems longer to me, but it's true. I remember our first meeting was in Weihenstephan in Bavaria. And the question is, why am I doing this? Well, I'm a doctor, and what I want to do is see healthy people, but in my daily practice in environmental medicine, I see that people really suffer from environmental diseases increasingly, and this is really what keeps me awake at night. And it's something, well, it's my goal as a doctor to make ourselves unemployed, basically, to make ourselves superfluous. We don't want to have sick people. We want to prevent disease, and I can see that the climate change really is very much a foe to me, because we are seeing more and more diseases related to the environment, and this is what's keeping me awake and it's keeping me on top of the subject. And in my field of allergies, allergy medicine, the treatment of allergics, this is something which is very much especially influenced by climate change. That's what's keeping me, my eyes on close to the ball, and I'm always pleased to see people who are allies to me, like you, Martin, and KLUG, and I feel part of a big thing. I'm really quite proud of being this part of the big initiative. I'm really impressed to be talking to 1,400 people, I think, at the German Conference of Doctors. How many? 250? Just smaller, but well, we'll go there next year. They want to postpone to next year. I forgot to introduce you. You're an environmental doctor, allergologist, dermatologist at the Klinikum rechts der Isar in Munich, and also the head of the Environmental Institute of the Helmholtz Center for Health and the Environment in Munich, and you've got lots of other tasks. But now we're looking forward to your presentation. Yes, I'll look at my screen. So, presentation. Hopefully you'll just see one slide now, right? Good, great. You also can hear me well? Yes, we can. So in the next 20 minutes I would like to, well, of course Nick gave a great presentation, an overview over the situation, and which is fantastic, and I also was impressed that he has described his own slide as maybe too busy. I don't think it's bad. I think it's quite good because it puts things on one slide. It's the link between environmental pollution and all these effects down here. And this will be one of my main messages today, that everything is connected. And I looked at the effects of environmental pollution on our health, and everything is related to climate change. And of course there is a mutual potentiating effect. This is why I like this slide. But I'd like to go into more detail now. So what is the effect of climate change on health? Of course there are direct effects, and Nick mentioned especially the effects on mental health through all these extreme weather events, basically. And I thought that was very good. And when it comes to, in particular, mental health, we need to try and understand much more. We have to do more research there. And then there are these indirect effects because of the effect of the climate change on our ecosystems, on the air quality, water quality, and so on. And then there are, of course, the social dynamics which impact all of us. So when we talk about climate change and health, then there are both direct and indirect effects playing a central role. And when we talk about the organs which are mainly hit, well, basically it's nearly every organ which is affected, but especially the interfacial organs, the respiratory tract, the lungs, the skin, but also the cardiovascular system and the mental health. They are can be severely affected. And one of the main points I would like to put across today, which is we all realize, is the link between environmental pollution and climate change. And we know that environmental pollution makes us sick drastically. Environmental pollution is one of the 5 environmental factors which have been accepted by the WHO for 2.5 years now, that they can support chronic inflammatory diseases. And this link between the two has to be borne in mind when we look at epidemiology and studies. And we have to bear in mind it's the mix which impacts us both between climate change and environmental pollution, which both impact our health. And this is a picture which I drafted together with the Helmholtz Center, and using this picture I would like to talk about the various aspects which impact us, and would like to put a special focus on Europe and the things which also affect us in Germany, for example. It's something which we need to put across in education too. So let's get started with the mental health. And I would like to show our own data at the clinic of Augsburg University Hospital, where we look at the link between the weather, not just climate, extreme weather events, and the impact on stroke. And I think this is one point which will be more focused on in Augsburg, because we are getting lots and lots of patient data, registered data, showing us the link between disease and certain climatic conditions. And here we have the stroke data, where we know everything, for example, basically for every day of the last 15 or 20 years, at what spot a stroke occurred, or what location. And together with the climatologists, we showed that dry, warm air increases the stroke risk. So it's not just the psyche, but it's just directly diseases of the central nervous systems caused by climatic conditions or influenced by them. And dry or hot air is certainly something which is increasing through climate change. Just one example from our research, which we've just recently published. Then my conviction is that there is this link between environmental pollution and climate change, and the WHO says that the air pollution alone has a massive impact on early brain development. And if you add climate change to the mix, then this is something which certainly impacts our mental health. Cardiovascular system. These are data by Annette Peters. I'm not sure whether anyone from the group is listening and watching. She has done great work in the field of climate change and health, and she has been able to show that as the temperature rises, there is a rise in the risk of cardiovascular disease. A massive increase, actually. And the other aspect is she actually can show that diabetes and hyperlipidemia also rise as the temperature rises. And it's important to investigate the molecular mechanisms of this system, or this link, because critics would say, what's the link, where's the link between diabetes and climate change and temperature rise? But this is really the task we have as scientists, to clarify this, to understand the molecular mechanisms behind this, in order to also come up with preventive measures. What can we do? Because in the end, we will not be able to prevent climate change from happening, just maybe dampen it. And the other aspect is infections. And what this shows you is the incidence of encephalitis in Europe. So far, we have a relatively low incidence of encephalitis in Europe, but in the course of climate change, the Helmholtz Center, for example, is carrying out some research on this and looking at the effect of the climate change and of ecosystems on these vector mediated diseases. And I think there is a lot of things in store for us here, because the borders, basically, the northern borders of malaria will shift northwards. When it comes to the skin and the lungs, this is one of our main topics, and we getting these news from the public media which show that climate change has an impact, for example, on pollen, and because of climate change, there is an increase in temperature, which leads to an increase in the pollen exposure time, and there is increased pollen exposure, not just because higher temperatures, but also because of higher carbon dioxide values. And this header climate change and pollen, there are different factors here, and for those people who don't actually quite know, pollen is an environmental factor which is normally responsible for pollination, but when pollen hits the mucous membranes, this can produce allergies, and pollen are increasing because of climate change. And so we have to think about this effect increasingly. And when we look at Europe, I mentioned previously that I would like to focus much more on Europe. We can see a rise in the pollen exposure, pollen abundance, but also more new types of pollen, for example, ambrosia. And you can see the spread of this species as it happened in Europe and causing increased allergy in Europe. Not just more pollen, but also new types of pollen which come our way. This is a forecast produced by Bütters from the Center for Allergy and the Environment, and showing for Bavaria how the pollen concentration looks like in Bavaria. You can see that by 2015 we'll see massive increase of pollen, and so there will be a massive effect on the quality and quantity and also the diversity of pollen. And because of the fact that we are seeing a pandemic with a viral infection, I would like to also point out this aspect. We've been able to show that pollen does not just cause allergy. Pollen can also paralyze the mucous membranes surfaces for viral responses. And in this publication, which is available online, we've been able to show that as the pollen fly, we also get more retroviral infections, and we have preparing a presentation where we see there is a correlation between the corona infection and the pollen concentration in the air. And this is something which we also need to look at in the field of climate change. As we have more pollen, there could also be a link to viral infections. Another aspect are chronic inflammatory skin diseases, which increasingly happen in summertime. For example, neurodermatitis, where we have been able to show that some of these neurodermatitis subgroups are triggered increasingly by pollen, and these are patients who I see on a daily basis. And this is what I mean, Martin. I can actually see these patients every day who are suffering from climate change, patients with neurodermatitis who, when it's hot and there is a pollen exposure, they can see an increase in their disease. Daniela Bayer may also be amongst the listeners, and she's working on this subject, which is extreme weather events, especially thunderstorm asthma. So in the Nick's home, we've been able to see, not us, but the scientists there, that when there is a thunderstorm, there is an increased incidence of asthma, and these extreme weather events are set to rise in the wake of climate change. And we are investigating what has been observed in Australia, epidemic asthma attacks during thunderstorms and pollen storms, basically. And the similar things can be seen in Augsburg. We can see a correlation between certain species of pollen with asthma attacks in children and adults. So this is a publication which is going to be continued, and we're expecting some exciting data there. And especially, that's my point, the point is to give people some advance warning. There is a thunderstorm, there is more pollen, so increase your asthma medication accordingly and make sure that you can adapt to the situation. This is really what it's all about, increasing our resilience to climate change. So when we talk about the effects of climate change on us, we need to bear in mind always that these pollutants have a direct impact on us. And what I've just told you is also about the effect on the ecosystem. So pollen, for example, virus-borne diseases, and this also has an impact on us and our health. We need to bear this in mind, environmental change. So, to summarize this, the direct and indirect effect of climate change on our health, on our different organs, this is something which is evident, but which need to carry into education for medical students, for example, and junior doctors in Augsburg. We're going to set up a Center for Climate Resilience, which is closely connected with the medical university, in order to really carry education across to students in order to create resilience and response. And I would like to spend the last few minutes basically on just a few ideas, because we're talking about transformation, how we can trigger transformation. This is what makes you active, Martin. I'd like to just address a few points. As we just heard, obviously there is an effect visible in Europe, but otherwise climate change hits the poorer countries, socioeconomically disadvantaged countries harder. That's the first point. And the other aspect is the link between the pandemic, which we're seeing now, and which we're increasingly going to see more pandemics, and climate change. And this is something we need to discuss. The loss in biodiversity, which clearly is related with these zoonoses. And when we think about the future scenarios, we need to also put this into the equation, apart from what I showed you before, the pollen and the viral infections. But the loss of biodiversity also is related there, is connected there, and it's something which is crucial for the transformation aspect. And I'd like to end with this picture, something which gives us food for thought. We should listen more to Alexander von Humboldt, who said everything is interconnected. And this is a picture of Mount Chimborazo, which he climbed, and where he has put everything down. He jotted down everything and the connections between things. And once we've understood that everything in this world is connected, especially our health depends on the planet, then when we understand that, we'll have understood that we need to achieve transformation. Thank you very much. So I would like to pass the floor on to the next presentation. The top presentations really fit together well. Nick talked about the global perspective, working together in huge networks of scientists, and you, Claudia, talked about the perspective for our latitudes, but also always with reference to global aspects. And Professor Gunga is going to talk about heat, especially now in May and June. In hotter times, you can really see what's happening in concentration. He's a physiologist at the university and at the Charité, and has created a great center for spatial medicine, or space medicine and extreme environments, something which has fascinated me because alongside his studies, medical studies, he has read paleontology and geology, so he's broad-based and also understands what planetary health could mean from the perspective of our history, which dates back many thousands of years. Professor Gunga, we are glad you are here, and I'd like to pass the floor to you. And let me also add that afterwards we'll discuss that heat will be a key subject now in the next few weeks, because it's obvious now that every year several thousand people will die prematurely, and we haven't got prepared for that in Germany to avoid deaths which can be avoided by in the communities. And we'll discuss it more, but we'd like to pass on the floor to Professor Gunga, and Felix will show the presentation. Well, thank you very much for the kind invitation. I'd also like to welcome all those present very warmly. My advantage is that I've heard two presentations now, and there are a few links, and I can also skip a few points. So let me get started with the topic directly with this slide. And Mr. Herrmann, you also pointed out correctly that I've got some affinity with geology and paleontology, and I'm very keenly interested in evolutionary history. And during my studies, I have observed climatic changes and worked on those. And my first picture, it goes in this direction because it shows something which some of you may know. In the last 10,000 years, we've had a more or less constant climate. And I'd like to point out this is a logarithmic scale, so the right-hand side is 100 years, and the same distance to the left sometimes is 1,000 years. So are the periods of rapid rise of temperatures. 55 million years ago, we had an even bigger rise of temperature. We don't actually know why this was, but when we look at our climate now, there seem to be several indications that humans have a decisive impact on this steep rise. Therefore, it may be interesting for our development as physiologists that in our climatic development in the last 20-25,000 years, we've been living in a relatively cool environment, and we've just heard by Ms. Traidl-Hoffmann that these studies should give us more information about how certain diseases are linked to heat stress and also, for example, diabetes. And there are some pointers to that in physiology, but I'd like to pick this up as a critique of the research we have in physiology. We have lots of data about climate change and meteorology, but climate change and health, well, there are also lots of publications which were added to this in recent years, but unfortunately there is a lack of basic studies into physiology and the effect of physiology of climate on a healthy person before we talk about sick people in literature. So I can see there is a big bottleneck of research. So maybe there are some molecular mechanisms which we find, but if you think about this from a physiological point of view, then lots of things are still unknown to us as to how things work together. This is also a problem as to how we can maybe stop this gap. So we've had lots of years, lots of time, 10,000 years where the climate was constant. But if we look at this known picture, and I will concentrate on this picture from now on, we've talked Europe previously, but I would like to put the focus now on Africa for two reasons. One is in Africa, we can see what will also happen to the Mediterranean and also to the north of that. So there will be similar consequences. So the sub-Saharan Africa, this region is very interesting field of research for us climatologists and physiologists to see how people will react to these extreme climates and what the adaptation mechanisms are and where the limits of these mechanisms lie. 30 years ago, as Mr. Herrmann asked about the tipping point of Nick Watts, as to what made people think about this. 30 years ago, I worked in Ghana in the field of labor medicine, in mines, for example, and rivers, and I realized at the time that something is completely wrong there, because the population there should by rights be adapted to heat and adapted to the environmental conditions, also genetically speaking, but I've seen that this was where people really came to their limitations. And the current research which we just started together with a Heidelberg group in the field of a DFG research project. So we looked at this sub-Saharan region, which also has been mentioned by Nick Watts, and we have identified it as one core point together with meteorologists, with epidemiologists, with hydrologists, and also with us as physiologists. So basically it's two regions. It's Burkina Faso, close to Ouagadougou, and also the other region is Kenya at an altitude of 1,500 meters. So in the next 3 years or maybe 6 years, we're going to observe these two regions and the effects of climate change on them. Why is this scale so interesting? So if we look at the change of color here, we can see that we are moving around in an area which even normally stands at about 28, 27 degrees, wet bulb globe temperature, WBGT, and this is something which you should really watch out for. When you read these articles about the climate, unfortunately there is always a confusion about the temperature we're talking about, the type of temperature. Normally in these articles they talk about a dry air temperature, but then it will be maybe 25 degrees dry air temperature. But in the presentation by Ms. Traidl-Hoffmann, we also really saw there is a big differentiation as to whether this temperature is combined with humidity and with wind speeds, with radiation, for example. All these factors play a role as to how the body reacts to these temperatures and these environmental conditions, radiation, wind, and so on. Of course, the clothing also is a factor in which the response may be different. So the wet bulb globe temperature here, we can perform normally up to a temperature of 26 degrees, but beyond that, with each degree of WBGT rising, this is going to become, our performance is going to go down, our productiveness at 32 degrees. There is a steep drop, and at 35 degrees, we are simply no longer able to do any kind of activity. And this shows you that there are very large region, this region here, south of the Sahara, where 300 million people are living. These 300 million people will, in the next 20 or 25 years, be talking about a temperature of 32 degrees, exposed to 32 degrees, 33 degrees WBGT, and this is very bad for our physiological performance. And this environmental temperature, humidity, wind speed, and so on, they influence this WBGT temperature. And this is the criterion when you talk about heat stress or heat strain. Then there are very different physiological factors such as age, such as gender. That's also an important point. Because if there are studies about physiology and heat load, then I would say 95% of these studies have been done on men, normally in climate chambers. And there's only a fraction of studies concerning women. So there is a huge potential of studies still to be made about the adaptation of heat of the human body, the metabolism, the cardiovascular systems to heat stress. So basic studies must be done there. And then there are also subjective measures which we have and which we want to have in our study groups, for example, cognitive changes and the reaction to physical work. And now on this picture we can see how these environmental data relate to clothing. That's also important. If I have studies, especially Indian studies, are available of course, but I have to factor in that the clothing of men and women is different, and there are different heat mechanisms playing a role here than if you just study men who are maybe lightly dressed in order for them to do physical activity, and this will then cause different heat stress. But the word heat stress, as a physiologist, I don't really like the term heat stress too much, because it's not about the question as to how the heat impacts the body, but how the heat deals with the stress and reacts to that, which should be called heat strain. So what we should be talking about is, on the right-hand side of this picture, the strain on the body, the deformation, physically speaking, of the body. And of course then we have various factors at work here, parameters which I have listed here. Also, for example, medication. We have got an increasing age of the population. What will the influence of medication be? And on the next slide, we can see this mechanism again. At the foreground, we have heat stress, but what I'm more interested in is heat strain. And heat strain can cause organic damage. It may also cause reduced performance, and in fact you can see this direct case of heat stroke which has been mentioned, and the consequences which may be death, or especially also there could be a quite increased frequency of kidney disease. Very young children and the senior population is also affected by kidney disease, but just because their kidneys are no longer able to concentrate urine at higher temperatures to such an extent that they can retain certain liquid. And of course what's also important is physical activity, and there could also be an increased risk on mental health, and this could also then cause accidents. I would like to focus on the fact that climate change has a direct impact on health and physiology, and it also has a big impact on work capacity and also the economic output which a society can deliver. This is described here by negative impact, which is a very euphemistic description, negative impact on the community economy. And this is the last picture, last but one, which I'd like to show you. It really epitomizes what I would like to talk about in this presentation, what my message is, because you can see on the y-axis the percent of the hourly working capacity. So how long can someone work in percent? And at 26 degrees WBGT, this combined temperature there, as an adult, a healthy adult, you can really deliver 100% of your work capacity. But as soon as the temperature increases by 2 or 3 degrees, so we're talking about 32 degrees, for example, depending on the study, you have lost 50% of your hourly work capacity. And just before I said that 300 million people are living in sub-Saharan Africa. Well, their life depends on what they cultivate themselves. 280 million people there live off the land. So the subsistence agriculture under the most recent statistics which I got from the World Food Organization. So 280 million people live of what they have cultivated with their physical work, and they eat what they have cultivated. So it's an easy equation. If by the year 2030 or 2040 or 2050 this region suffers from climate change to the extent of 2 or 3 degrees only, then their productivity will go by 50% at best. This will have a socio-economic impact, which unfortunately, which is an issue in this sector of climate change, and this is something we've discussed in the research unit. I think we have a problem of scaling. We may be able to look at a village because we can't look at 1,000 villages. We don't have the means for that. Also the technologies, we lack that. So we have a scaling problem. We can analyze one village in Ouagadougou, maybe. We've got 30 couples who we will then observe for 2 years. But what happens 100 kilometers west or east of that, we can't really say. So if I look at it very closely and neutrally as a scientist, I would say we have a data problem, because in a small location, we have to start working on a small scale, and then we're supposed to scale it up to the whole of Burkina Faso or to Kenya, and then also if the best thing you could do is also talk about West Africa or East Africa at large. And this is what politicians want us to do. If we talk about 30 people in the village in Burkina Faso, then politicians may say that we picked the wrong village. So it's easy to take our arguments away. So we have a structural problem and a methodological problem. People talk about heat stress, but how shall I measure heat stress as a physiologist? Well, I would give someone a rectal probe which goes 20 centimeters into the rectum to measure body core temperature. But this is not something which you can normally do in the field in Ouagadougou or somewhere. You will not find any study people there, any volunteers. So you need to have a technical means of measuring body temperatures in a non-invasive way continuously. So even if we all realize there is a big problem, well, there are still a large number of examinations of techniques we are missing as to how different people, how different groups of people, different age groups, different medication groups or physical fitness groups react to heat waves. And this, of course, is something which will also affect us here in the next heat wave. Who is going to be hit hardest? Who are the ones I have to look after first? And who are the ones I have to do some preventive measures for, and how can I communicate that? That's an important aspect. So from my point of view, I don't want to end on a too pessimistic note, but I would say we've got still a lot to do. Thank you. Thank you, Mr. Professor Gunga, for your presentation. I would like to ask 2 questions. The first to you directly. You've talked a lot about heat stress in Africa, for example, but now we are in front of our laptops because this is Corona time, and you've seen the pictures. Maybe you've experienced it yourselves as to what happens if you're in the hospital. You're not lightly dressed, not according to WHO recommendations. You've got a mask, you've got gowns, and you've got gloves. So what can we expect this summer in terms of our heat stress? If there's more stress even. Well, I would expect a new study because, again, if I look at hospital staff in intensive care units, what is the heat stress if it's 25 degrees or 27 degrees or 23 degrees under this clothing? Well, there are no answers. Of course, there are studies about fire brigades and bomb experts and so on. There are studies as to how this impacts health, but at Charité we have got a study undergoing the approval process where we want to measure on the staff themselves with these devices. This is a system with which you can measure someone's heart frequency over 48 hours. And the other thing is we have a sensor, which you can see here, which you stick to your forehead like this. And this goes under the mask. This is the storage device, which we've developed a small part which weighs 5 grams. It looks like a cookie. And this measures the temperature in the head. This is very important for us as physiologists. What's the temperature in the head? Well, the temperature in the rectum is less interesting for us as physiologists for the purposes of this study, at least. And as we've heard in other presentations, the cognitive performance can be, you can measure as a physiologist as 38.2 degrees, the cognitive ability will go down. So that's, I'm talking about the core temperature. And at 39 degrees, for many people, there is a very sharp drop in cognitive ability. And so what do we have to look at? This may be your question. For example, we have to think about the fact that the hospital staff, carers, doctors, maybe should have longer rest times between their jobs, because you can't just undress completely for half an hour and redress, because this will cost another half an hour. So we have a procedural problem, and also the problem that the heat must be passed off to the environment, but you can't because you're in this very restrictive clothing. And if we get a combination between COVID-19 second wave and a heat wave, then I think there is a big issue we need to grapple with. Thank you very much. And there is a second question to both of you, really. It was mentioned that there is this Center for Climate Resilience, and this course also is interested in transformation. Maybe, Claudia, you can tell us something about what it takes to create this center. It always sounds so easy, but the road to that is going to be very stony, I would assume. And also, Professor Gunga, you've got your own history about heat physiology and teaching. Professor Traidl, thank you very much, Mr. Gunga. The Center for Heat or Climate Resilience is something which is about to be founded. It's not there yet. We are in the planning stages, and well, what happened is there was an initiative in the political discussion last year. It was quite evident that the climate change is here. This was also very much discussed in Bavaria, and politicians simply said, please create a center for heat or climate resilience, and that's triggered us at the University of Augsburg as to how to do that, the structure for it, and we've outlined a structure and we pass it back to politicians. And so there will be professional chairs created, also interdisciplinary. There will be lawyers, there will be IT specialists, economists, and so on. And this is precisely what we need. when it comes to creating climate resilience. This is only possible in an interdisciplinary basis, and also this is how we get transformation. So the impulse came from the obvious need which was felt to create the center. So you could say it's a result of Fridays for Future and the whole future movement, because politicians only understood the topic when we hit the streets. This is correct. This is a reaction to a need. So the impulse certainly came from the fact that people felt there is this need, this demand in the general public in Bavaria, in Germany, and politicians reacted to that. And the point of resilience was very important then, because we've just had the question, climate change cannot be completely stopped. And you can correct me if I'm wrong, Martin, the climate change is here to stay, so we have to make sure that we limit climate change, that we make the 2 to 3 degree limit. But still we need to adapt, because even 2 or 3 degrees mean a lot of health problems. Professor Gunga would like to come in also. Well, I can also contribute there. Of course, here in Berlin, we have the fortunate situation that we are located between two poles, the PIC as a meteorological institute and the Charité, and there is a great contact there. Historically speaking, it's interesting that one founder of climate physiology lived here 100 years ago. He reflected on what the impact of climate is, and he made some studies 100 years ago, so this is not all new. But so we have a long history of this research, and my Institute for Space Medicine and Extreme Environments, well, Mr. Zunz, this scholar, also thought that you should use balloons to rise to the atmosphere and measure the atmosphere there. It was quite a dangerous thing, and he was the physiologist who created the breathing devices. He was the first high-altitude physiologist who looked at the impact of high altitudes on health, and his standard textbook, and all the doctors who look at high-altitude physiology will look at that book, High-Altitude Climate and Mountain Walking. Why am I saying this? Well, I'm saying this because these gentlemen worked in this field and trying to make it understandable to the general public, and also to use the right language for that. They have their own language as to how to communicate science. If you're a scientist and you try to entitle your book High Altitude Climate and Mountain Climbing and the Impact on Health, I think the publishers will be very cross with you because it's too popular. So, but we have to think about how to communicate results, how to put messages from science, results from science, across to doctors, to patients, and also the general population. That's the only way we can make politicians change, if we as politicians can communicate much better. Louisa, would you like to ask a few questions? Maybe we can address 2 questions. We've gone over time slightly. I would like to start with a question from the listeners to Professor Traidl-Hoffmann, whether she could talk about 2 effects on health. The first, the link between dry, hot air and stroke risk, and the second, the effect on mental health. Maybe you can come in there. Well, for the stroke issue, in fact, these are studies where we've seen an association, but we need to look at the molecular mechanisms behind them. This is not the case yet. We need to investigate these molecular mechanisms, but the start is that you first of all see the evidence, epidemiology, of course, by excluding the confounding factors, and then you go into the molecular mechanisms, and this is true for stroke. And the other was mental health. Well, that's a very wide field. The sheer effects of wildfires, for example, it's a simple mental stress issue. Depression can be caused by this. And the other aspect is neurodegenerative diseases, where we have quite good data which show that ultrafine particles and Alzheimer are correlated, that particles actually have been found in the brain. And again, we need more analyses in order to understand the molecular mechanisms. These two things have to go hand in hand, and for many things we haven't got a solution yet, or the answer yet. Thank you very much. That was nice and brief. Second question to Professor Gunga about literature, whether you think, so with temperatures, whether the body can adapt to high temperatures over some time, how long this would take, and when it comes to working capacity, whether you can adapt, and whether in this working capacity you are focusing on physical performance or mental performance. Well, thank you very much. Of course, you can improve your heat adaptation short term. Sweat production can be increased. For example, if you go to the sauna for 1 hour every day, of course, in several steps or intervals, then you can increase your sweating capacity. Then you will increase the amount of sweat. So you can secrete more sweat, you can evaporate more sweat, and this will cool down your body at an early stage, so you do not run into hypothermia. At the same time, you change the electrolyte budget in the sweat because it becomes hypoosmolar. Normally it's 100 milliosmol. Maybe after 2 months it's only 30 milliosmol, depending on how you train. And in the slide you showed about the work capacity. This was about physical labor, which was made at 300 watts. So it was a medium type of work performance. And this is a study basically on male workers in India, and looking at the physical work capacity. Cognitive work has not been looked at in this study, but as soon as you have a temperature of 38.5 degrees, 39 degrees, cognitive performance and concentration will go down. And it's a danger, of course, for yourself and also for society at large if you're working at a critical workplace. Thank you very much. Finally, would like to ask both of you, you have given us a big overview over various topics, whether you would like to make a summary statement about the situation from your point of view. It's a question to me or to everyone? To both of you. Ms. Traidl-Hoffmann. Well, I can only appeal to my medical colleagues. Nick said that the medical colleagues are complicated, and of course we are complicated, this may be true, but we also have the chance to be a mouthpiece and to achieve transformation if we speak up and we say that climate change also is a health risk. Then we can actually make a change or initiate transformation. This is something I will continue working on, and I would be glad if we can do so as a team. Right. Actually, I'm very impressed by the fact that we have very flat hierarchies here. We have students from the 2nd or 3rd or 5th semester here, but we also have people on the other hand at the Lancet level, and the different communication organs and universities are interconnected, and that's great. And it's also a first in many respects, and we should use this, exploit this, which is good. And I have carried out a event with Ms. Hartmann and Mr. Herrmann. I'm very impressed by that, and I would like to wish you all the best so that you can really talk to the right people and tear them out of their niches, making sure that they share their knowledge with us. So thank you very much.